Thank you for joining us on Health Diary. My name is Gladys Gashanja and we're coming to you from the 4 Points by Sheraton here in Hallingham. Now, expectant mothers are highly encouraged to take folic acid, especially during the first trimester, if not earlier. This is because the lack of the same could lead to birth defects, one of them being Spina Bifida. Now, this condition is associated with disability and other complications. But as you will hear today, a diagnosis of the same does not mean the end of the road. More on Spina Bifida, starting off with this fact of the matter. Spina bifida is a birth defect that occurs when the spine and spinal cord don't form properly during the first weeks of pregnancy. This can cause permanent damage to the spinal cord and nervous system, resulting in paralysis of the lower limbs or problems with bowel and bladder function. There are different types of spina bifida whose symptoms range from mild to severe depending on the type of defect, size, location, and complications. In some cases, early treatment for spina bifida involves surgery, although this doesn't always completely resolve the problem.
Phoebe has spina bifida and hydrocephalus, and right now she's 27 years. The back was swollen, and one of her feet was dislocated at the hip. And when Phoebe was about 4.5 months towards 5 months, so that is when she underwent her first surgery. After recovery, then we learned that she needed even more series of surgeries because of her legs, her hips, her spine. For Phoebe to walk, she has to put on her calipers, use crutches, and also use a wheelchair. Our children struggle with toileting. They have to wash their hands, get their catheters, time their bladders so that they can be able to empty their bladder after every 3 hours. So this one, usually it is used by older children to empty their bowels. It is called enema bag. For us, we really encourage our families and children to follow a daily program. Again, not all children are supposed to use this. It is recommended by our neuro nurses. My first stigma was when Phoebe was born, because I was told if I was aborting, I could have aborted the child well, completely, and not ruin her. People will look at you and wonder, Wani, this one, they cannot walk. They must be pushed with this wheelchair. What is wrong with them? And you know, sometimes when Phoebe was in primary, I could go and empty her bladder. So children would feel, I'm really nambebi, nambembeleza. Accept your child the way they are, but also seek to get the best services that you can. And don't struggle alone. Reach out. Again, we draw our strength from the group of parents. We have a parent support group. It is expensive. So for us, the cover that we really run to is NHIF. So if the schools have stairs, what does that mean to someone like Phoebe? She's disabled. But if the school has a ramp, she can access all the floors. If the system is accommodative, she can compete at the same level with the other children.
Spina bifida is our conversation of the day, and would like to understand this more. To help us do so, we have Dr. Michael Magoha, who is a consultant neurosurgeon, and we are also joined by Stella Cherop, who is living with spina bifida. Thank you for your time, Dr. Let's start off with the fact that they say it is a birth defect that occurs when the spine and spinal cord don't form properly. Before we get to the nitty-gritties of that, at what stage of pregnancy does this occur?
It tends to happen before the mothers are aware that they're pregnant. So what we call neurulation happens in about 3 weeks. So at this time, you might just think that you're late or you've missed your period. That's the period at which the child would form a neural tube defect, as we say.
Okay, and you talk about a neural tube defect. What is a neural tube and which other organs are formed there?
So at about 3 weeks, you get a forming of something that we call a neural plate, which forms into a neural tube. So that happens at the midline at the back. So during that period, We form multiple structures. So the spinal cord, the brain itself forms from that, and the connections to multiple different organs. So neural tube defects are a myriad of diseases that could keep going on and on, but simply put, issues with the brain, issues with the spinal cord, and issues with fat and muscle being in the wrong place in the midline.
So is it, or would this explain why women or pregnant mothers are told to take folic acid, especially in the first trimester?
If you take it in the first trimester, it will not prevent neural tube defects. It should actually be what we call periconception mothers. So if you are interested or thinking about getting pregnant, that's when you should have folic acid supplementation.
And this is if you are susceptible to actually spina bifida, that is.
Yes, there is a hereditary association, but what I want to make clear is that nearly everybody is susceptible to spina bifida.
All right, so let's understand the journey therein. Stella, you were born with spina bifida. How early in this journey did your parents understand what you were dealing with?
I was born with spina bifida, and then my parents noticed that there was something abnormal. So they sought for, advice, and unfortunately they were advised that I'd need to go for a surgery when I'm 4 years old. They noticed that I had some kind of swelling on my back at the very bottom part of my spine. So yeah, and then it kept growing as I grew.
All right, and is this something that they had been warned of, maybe when they were doing ultrasounds during pregnancy, or they found out when you got here?
They found out when I got here, and they had never known about spina bifida. They didn't know anything about it. And also the hospital that I was born in, I think the doctors weren't very conversant with spina bifida.
So, Dr. that brings us to this question. Can scans during pregnancy pick up on spina bifida?
Yes, they can. First of all, a little bit about spina bifida. It depends on the level and the section at which it is and how big it is. So depending on that, you can still find it. Normally between 16 to 18 weeks, if you attend regular ANC visits, you should be able to pick it up early. But sometimes it can be occulta. So occult, unseen. So with those, you might not pick it up if it's not that bad on the ultrasound. But when they're born, when you examine the baby, you'll start to notice a few small things. Like they might not be moving their legs as well. Their urination might be erratic. And the easiest one is at the back. If you feel the back and the spinal cord, you'll feel a place where the bones haven't fused, and you might see just a little tuft of hair that is there. That could be a sign of spina bifida.
Okay, so what causes the spine and spinal cord not to form? Again, let's go back to the causes. You mentioned genetics. What else?
There could be exposure to multiple drugs, ethylenes, plastics, but during periconception, the first 3 weeks. But all of those have been noted to be minor risk factors. The major risk factor, and if there's one take-home message that I would say today, is folic acid supplementation if you're planning to get pregnant. That, and of course, if a mother has a previous history of spina bifida, the risk is slightly increased.
Okay, so Stella, you say that was the first time that we're hearing of spina bifida. Do you have any relatives or anyone in your family with any other neurological condition?
No, there is nobody in our family that has spina bifida.
Okay, so Dr. explain why or how genetics would be at play here.
To be very honest, we don't know. At present, we don't know. If you think about surgery in itself, we can't do experimentation where we try this with one person or try it with another person because it's unethical. So that's why it'll look like we're behind in understanding things like birth defects. The second thing, something like a birth defect is something that should be classified as rare. This is classified under preventable birth defect. So once we understand that, you can prevent it from happening.
Let's talk about the types. You mentioned occulta, you mentioned cystica. Do we have any others that you come across?
They're cervical, they're thoracic, and then they're lumbar types of spina bifida. As we said prior, occulta it's hidden. They just have some symptoms, but you can't see them and see it clearly. Cystica, you'll see a large cyst at the back. Now, next, apart from anatomically, we say what is in the cyst. So if you can't move your arms or your legs, or there's an issue with your abdomen or urination, what it would mean is that the nerves have gone to, in the cyst we have something called the placode, the nerves have gone to the placode. So we give it a nice hard word called myelomeningocele. Sometimes it's just the water that covers the spine and the spinal cord. So you have a cyst, it looks very scary, but the baby is moving, the child is moving. So that one is perfectly fine. That one you just call it a meningocele, meaning it's just a sac filled with water. Those are the two easiest types that I could say. The other ones which may not be compatible with life is a complete split. We call that rachis. So the spinal cord is completely split. It looks very scary.
Yeah.
And associated to that, sometimes brain itself can come out. And now we call that an encephalocele.
Okay. So, Stella, you say your parents were told to wait until 4 years. Then at 4 years, what happened?
So at 4 years, they were referred to Kenyatta National Hospital, and that's where we came. And then they actually did a surgery on my back and then removed the kind of sac. Yeah.
Okay. And what symptoms did it come with? Do you have to live with?
So at first, I had bowel and, what is it called? Urine incontinence. But as I grew, my bowel, I got to learn how to manage my bowel management. And then with time, it just, became normal. So up until now, I have to live with urine incontinence. And I guess it also came with me using now a wheelchair, but I also use crutches sometimes.
Do you remember a time when you were younger when you ever walked?
Without crutches, without any support, no.
Not at all. Okay, Daktari, is this something that is associated with cystica?
Well, yes, it depends on what's in the cyst, in the balloon. Remember, as I said, we call it a placode. So what that means is, as the nerves are forming, instead of going to where they should be working, they go and land in that little mass at the back. So it's very important to understand that it has already happened. So the main thing of the surgery is to prevent that mass from attaching and pulling other nerves so that they don't get worse. The next thing which she said is, if the nerves aren't going to the lower limbs, the next issue is, are they going to the bladder? Are they going to the bowel? And indeed, 75% of people with spina bifida, the main cause of death for long term would be renal issues. So if they've not learned how to take care, and I'm very happy this young 20-something-year-old lady, if I'm allowed to say that.
Yeah.
So she looks like she's managing it very well, and that means that she's out of the risk period, but she's aware, and that's the most important thing.
Something else, that females are affected more than males, true or false?
Yes, that's true. There is a slight female preponderance. The next question you're going to ask me is why?
Yeah.
I do not know. If I remember, the male-female ratio in the world was about 1.2 to 1, so it was slight. It wasn't that great. But yes, it is there.
Okay. When we come back from this short break, we hear from Stella in as far as the complications that come with this condition, even as you grow older, and of course, understand the stigma involved living with this condition. We'll be right back. Welcome to Health Diary. My name is Gladys Gashanja, the conversation Spina Bifida. Helping us along, Dr. Michael Magoha, consultant neurosurgeon, and of course Stella Cherob, who is living with this condition. And Dr. even as we talk about the risk factors, there's one here that stands out in as far as spina bifida is concerned. And the question is, you keep saying having folic acid is important. Food is also a huge component in as far as folic acid is concerned. Which are these foods perhaps that we need to keep top of mind?
It is fat soluble and it's in multiple things. So green leafy vegetables should be there, legumes. However, as has been noted all over the world, WHO has something that we call IFAS, iron and folic acid supplementation for pregnant mothers, because as has been noted, it's not normally present in diet. The good news is, if you have it a bit in diet, it lasts for many years. But given our local diet, I think it would be missing in most of the things that we do, unless you really love those green leafy vegetables of yours. And what is recommended is about 400 micrograms for pregnant mothers. From dietary supplements, you normally get 8 to 12, sometimes can reach up to 100 micrograms. So IFAS recommends that you supplement 100 micrograms, and it should be in everything. Cereals, legumes, oils, fats, unga. So all of that should be there.
All right, so let's talk about these symptoms, Stella. Do they get better with age or worse?
I can't really say, because for me it actually seems like it's getting better with time. But I've also had friends who, it seems like there's no change at all. And then there are some, of course, who it's just constant.
Okay, so since the surgery, what else have you done to manage this condition?
Pretty much nothing, because afterwards we just taught to learn how to manage it. Observe, timely catheterization, make sure that you go for your kidney scanning every now and then.
Dr. explain the discrepancy. Others, it stays constant, others, there's degeneration.
Not all spina bifida will be equal. So, for example, if it's higher, and if it's what we call myelomeningocele, where a lot of the spinal cord goes there, sometimes it's just a matter of time. And our job is to make people comfortable. If it's lower and less attached, then they can have a long, fulfilling, healthy life. As long as with the things that she just said, bowel and bladder control, and they have fantastic lives. Most people, you wouldn't even know why they're on a wheelchair.
Okay, and explain this about occulta. I've read some stories of people who did not know they had the condition up until they were adults and got the diagnosis then.
In the forming of the neural tube that I said before, sometimes you get what we call mesenchyme, which forms all the connective tissue, muscles, fat, ligaments. Some of that can be inside your cord, and it can hold and tug on the cord and pull it down. So you would notice when you're very small, but as you grow, you start to pull and you start to get some weird symptoms that you can't explain. So problems with urinating, you feel like your legs are weaker and you can't tell what's happening. So that's part and parcel of the disease in occulta. You can't see it outside, but if you do a scan, you will see that there's something that's attached.
We've talked about living with this condition definitely takes a lot of management, but not everyone understands this condition. Talk about the stigma perhaps you faced.
I remember when I was in primary school, at that time I wasn't really sure how to manage myself. And so at that time I used to use, Pampers most of the time. But because we were not very financially stable, I'd use napkins instead. So because I was young and I wasn't sure why I am, sometimes I would just mess on myself. And then kids would, look at me differently, like, why is she messing on herself? So because of that, I'd mess myself and then just sit on it without changing myself. So that ended up causing wounds. But, in high school, at that time I had learned how to manage myself. I had learned how to do catheterization, and it was pretty okay. I didn't face a lot of stigmatization.
In some places, witchcraft has been brought to the table. Oh, your child is different. Why is it that they look a certain way? Why didn't they walk from the moment they were born? Dr. talk about ostracization that comes with this condition.
I've heard very different ones from different cultures. I can't remember. Off the top of my head, I've heard one that it means there's an evil spirit that was trying to come out of the child and then got stuck because of prayers and blessings. That's one that I've heard. The other one that I've heard was it was just a curse because the mother was unfaithful. I don't know. I can't explain any of these.
All right, so I'm curious to know, when it comes to your menstrual cycle, is it something that is affected or you have it as normal as the next girl?
I have normal menstrual cycle, just like anybody else.
Okay, interesting. Dr. Can they carry a pregnancy?
If it's a lumbosacral spina bifida, they can carry a pregnancy to term. The only thing is coordination and pushing might be difficult. So things like emergency cesarean sections could be considered. But the point is you can have a long, fulfilling, happy life.
When it comes to diet, do you have a special diet or it's filanga free?
I don't have a special diet, but I tend to just make sure that the foods that I eat are has folic acid. Yeah.
Okay. Apart from, the catheterization and whatever else, do you take any oral medication to support you?
No.
Okay. Interesting. So what informs treatment when it comes to spina bifida, Dr.?
The first thing would be, if you've identified spina bifida before the mother has given birth, there are different options that you can have. You can even do surgery while the baby is still within the mother. The other thing you can do is you can follow up the child with a good pediatrician. Then you involve a neurosurgeon once the child is born. then what we do is we assess the level of function. So how high is it? What are the other associated things? If they don't have any other anomalies and we can focus on the back, then we focus on the back. If it can be an open spina bifida, meaning there's absolutely no skin coverage, if that happens, then we don't work as an emergency unless you get the child within 24 hours. If they come after 24 hours, we wait for it to form something that we call granulation tissue, and we plan for the surgery. And what we'll do is try and disconnect. Sometimes we'll say, no, we can't do anything now. We wait for the child to grow so that there's more skin coverage, and then we plan for closure. The next thing is the follow-up. So you need to have good pediatricians who look for the complications, follow the urinary system. As she said quite well, the repeat scans. The next thing is psychological follow-up and assessment. Is the family aware? Have you been put into a very good group that understands what is happening, especially in our country? Thank God we have groups like SHAC, Spina Bifida and Hydrocephalus Association of Kenya, who are ready to walk with mothers and walk with children who have this disease.
Mm-hmm. And I'm glad you brought up the psychosocial support. Are you part of this association?
Yes, I'm part of SHAC, and that's actually the reason why I'm here today.
Excellent. Talk about how they've been of a support system.
Pretty much every year we have this youth, we converge as youth, and then we train on, we train on bladder management, bowel management, and generally how you get to interact with your peers.
All right. And is this support in the mashinani?
Yes, we have different branches. We have in Nairobi, in Kitale, in Kisumu. So it's pretty much all over.
Okay. I love the thought of that. And actually, there's something that you mentioned, fetal surgery. Do we do it in Kenya?
We don't do it in Kenya. I must be very honest, it sounds a lot more elegant than it actually is. So if I just break it down to what it simply is, it's doing a cesarean section and then somebody operates and you return the child. And of course, you can see the cost implication on that would be immense. So it's very rare.
Okay, all right. And speaking of the cost, how does that look like for you?
Quite expensive, I'd say, because I have to make sure that I change my catheter every now and then so that I just don't end up getting a UTI or something. Yearly, I have to go for a kidney checkup, which is also quite pricey. Using a wheelchair, of course, means I need to do maintenance on it. As soon as I feel like it's not fitting well, we need to look for a better wheelchair for me so that I don't end up getting any other secondary disabilities.
And all this, is it supported by insurance?
Not really. As at now, it's basically my parents.
Okay.
Yeah.
So it's out of pocket. Daktari, this is an expensive condition to manage. How does the person in Turkana deal?
The first thing is to let people know that this is actually a burden. The next thing is, after showing that it's a burden, we need to publish and show people that this is the situation. After we do all of that, then we can rally and get policies and raise resources so we can help everybody around.
Okay, so even as we bring this to a close, you are how old now?
I'm 25.
25, living your best life, living with spina bifida. What would you like to encourage both those who are living with this condition and also their caregivers?
Yeah, I think I'd like to say this is a condition that can be managed. You don't have to think of it as the worst possible thing that happened to you. So basically, it's just, seeking for information. Once you get informed, learn the ways that you can manage. And as an individual living with spina bifida, I think it just also needs acceptance. As soon as you accept that this is the way it is, then of course learn the management, how to manage it. Then from there, it's all good to go.
Okay, Daktari, I hear you making sure that you underscore the fact that prevention is better than cure. Perhaps you can close with reiterating the same and what we need to do on a personal level.
If you're thinking about getting pregnant, or if you think you're at risk of getting pregnant, start supplementation. Just start taking your pregnancy vitamins, even before. That's one, especially if you have a family history. Number two, if you do get a child with spina bifida, it's not the end. All of them are different. Every journey is different. And remember, it's a marathon. It's not a sprint. The surgery won't cure everything. You're with them forever, but it's okay. As you can see with her, life is fine.
It is, and actually you are in university, aren't you?
Yeah.
Yeah,
I'm in
living
my
her
third year.
best life. Yeah.
And the last thing that I would say is, remember, you're not alone. So there are many people walking through the journey together. You never know where life takes you, but it's always better when you're with friends, and they are there.
Very well said. Dr. Michael Magoha, consultant neurosurgeon, and Stella Cherop, living with spina bifida. Thank you for helping us understand spina bifida. Sounds like a hard word, but now that you know what it is and how you can live with this condition and live a full life, I think it does make a difference. Time now for a health tip.
Dental care during pregnancy is important, and actually the ideal time to visit your dentist is at the second trimester. There is research that has shown that, for example, if a pregnant woman has gum disease, you can have preterm low birth weight. There are medications that you can take that will affect the teeth of your baby. If you are in pain, please visit your dentist. When you vomit, you don't go brush your teeth immediately, because the vomiters is usually acidic, and this will demineralize your teeth. The myth about pregnant women losing their teeth because of calcium, it is just a myth. During pregnancy, women like snacking a lot, and sometimes they even forget to take care of their teeth, and this therefore will lead to demineralization of the teeth and formation of cavities.
Yet another informative episode of Health Diary. Thank you for your time and, of course, engaging us on our social media handles. My name is Gladys Gashanja, and we have been coming to you from the 4 Points by Sheraton here in Hurlingham. Until next time, see you